From the USA. No difference in venous thromboembolism. Based on venous injury treatment with repair or ligation surgery. Zuckerberg San Francisco General Hospital and Trauma Center, San Francisco, California, USA. Venous injuries are usually managed with vein ligation or repair procedures. In this study published in Trauma Surgery, AMP, Acute Care Open in March 2021, scientists are comparing the two modalities in terms of association with deep vein thrombosis, DVT, or a pulmonary embolism, PE. The retrospective analysis included 1,214 patients with lower extremity venous injury, encompassing iliac, femoral, popliteal, or tibial injuries. All participants were then stratified based on the procedure they underwent. The researchers primarily looked at the development of DVT, or PE, during the initial hospitalization. The results revealed that repair procedures were more commonly performed at each of the assessed anatomic levels. The highest rates of DVT and PE development were observed for femoral and iliac vein injuries respectively. In terms of outcomes, there was no significant difference between the two treatment modalities for all anatomic locations. These findings suggest that ligation and surgical repair do not differ in their likelihood of causing either DVT or PE. This highlights the need to always account for the risks of venous thromboembolism regardless of the treatment approach.